Good afternoon, and welcome to today's webinar on Healthy Childcare, Healthy Communities project. We're so glad to have you all with us today. Before we jump in to the webinar, we do have a few housekeeping items that we'd like to share. First of all, please do note that we have a handout in your GoToWebinar control panel, and you'll find the PowerPoint is listed there for you. You will also see an area where you can enter your questions. So as we move throughout the presentation, please do feel free to submit those questions into the question box. And if you need our assistance or have some additional thoughts to share, you can also use the chat box, and we'll be monitoring that throughout the webinar. This webinar will be recorded, and we will make the link to this webinar along with some questions that come up on the call available to you, and we'll be sending that information out to you tomorrow via email. So we'd like to give a warm welcome to some of our members, and just as a reminder, at Child Care Aware of America, our mission is to advance a child care system that effectively serves all children and families. And that work is really strengthened by a national network of child care resource and referral agencies, along with other diverse members and partners. So we're really appreciative of our members and our opportunity to help support you in becoming a well-known and trusted resource in your communities. My name is Sarah Diamond. I'm a Partner Success Director here at Child Care Aware of America, and I'm excited to help facilitate this conversation today and to be able to introduce you to a great lineup of speakers. So as you can see, we have some amazing experts who are going to be sharing some of their stories as we move throughout this presentation. And we've collected just a little tidbit on each of them. And so as they begin to speak, we'll share a little bit more about who they are, give them an opportunity to share their story, and then give you an opportunity to ask any questions that you might have as well. So as you can see, we have a packed agenda. We want to be able to share with you a little bit about the Healthy Childcare, Healthy Communities project, and then allow some time for our speakers to share a little bit from their states. We also will reserve a little bit of time to share with you about two other states in Illinois and New York at the end of the presentation, and then address questions that you have shared. So to help us get started, we're going to pass things over to Jessica Rose Malm, who is our Senior Health Policy Manager. And in her role at Child Care Aware of America, she uses research, policy, and practice tools to advocate for all children to grow up healthy. Jessica led the Healthy Childcare, Healthy Communities Technical Assistance Project this year, and she is here to share some information about our health policy team and provide us with some background on this great project.
Thanks, Sarah. I'd like to get started just by giving you a little bit of background on health and health policy at CCAoA. So you have an idea of how the Healthy Childcare, Healthy Communities project came about. So for much of our history, CCAoA has focused on advocating for minimum health and safety standards in childcare, including background checks, provider training, common sense regulations, and monitoring. With the reauthorization of CCDBG, much of what we'd been advocating for was included, which is great. So we quickly had to switch gears and focus on how best to support states and CCR&Rs in implementing the CCDBG health and safety requirements. This also freed us up to think beyond the traditional definition of health and safety and explore some new areas of health and childcare. Next slide. So this slide just shows the 4 big buckets of health topics that we think about now. Safety and environment really covers some of the things in traditional health and safety, like injury prevention and safe sleep, as well as some other elements of environmental health, like air and water quality. Those two buckets in the middle, nutrition, breastfeeding, active play, and screen time, are some of our core areas for health promotion. And then the last bucket is inclusion, which covers kids with disabilities, special healthcare needs, as well as mental and behavioral health. Next slide. We've identified a number of avenues for our work that can promote health and childcare and health equity more broadly. We try to think about our work from both the policy level and in policy development, analysis, and advocacy, as well as the practice level, by developing tools and strategies to support providers in building healthier childcare programs. And since we know kids don't grow up in a bubble, we also work to make sure families and childcare providers have what they need to be healthy role models and support children's healthy development. Next slide. And this leads us to the project that we're all here to share about today. Healthy Childcare, Healthy Communities was our second round of funding from the Robert Wood Johnson Foundation to provide technical assistance to diverse teams in 6 states. We asked these teams to select a health topic and at least one of those equity-rooted change levers from the last slide, and spend about 10 months working on the projects they proposed. In particular, we were interested in using research and presenting data in new ways to tell compelling stories about different aspects of health and childcare. Next slide.
Great. Thank you for that background, Jess. We appreciate that. So next to present information from the state of Alabama is Calisti Chong, who is the Early Childhood Program Coordinator for Alabama Partnership for Children. And she earned her bachelor's and master's degrees in Human Development and Family Studies from the University of Alabama. There, she coordinates efforts to embed obesity prevention strategies and best practices into existing state systems and provides training opportunities and technical assistance to childcare programs. She also has 2 sons, 6 and 3 years of age, that keep her very busy. She's going to share some information about the Alabama Farm to ECE Coalition and how CCAoA supported the coalition in developing a community-informed 3-year strategic plan. So welcome, Calisti.
Thank you very much. Thank you to the Childcare Aware of America team for this opportunity to share about Alabama's Farm to ECE initiative. We certainly could not have made so much progress in such a short amount of time without your guidance and your support. So in Alabama, we have worked with both Nemours and Childcare Aware of America over the last 3 years on our obesity prevention work with early care and education providers. Alabama is extremely fortunate that we were able to participate in round 1 and round 2 of Childcare Aware's Healthy Childcare, Healthy Communities project. The first was really focused on a broader range of health topics, and the second has allowed us to focus on a particular area of interest for us as Farm to ECE. So during the last 6 months of the initial opportunity, we began to explore Farm to ECE and began to invite other interested partners to join our monthly calls and the conversation. It was through this opportunity and those conversations that we were really able to begin this process of building a coalition of motivated partners to determine what needs to be done in Alabama to build a comprehensive Farm to ECE program. So, and you'll see on the screen listed are our key partners in this work, which would include our State Department of Agriculture and Industries, several partners that function as food hubs, and even several partners that are child care resource and referral agencies. And through this work, we've decided that we want to support child care providers in their efforts to implement Farm to ECE activities, focusing on 3 things: procurement of local produce, food and agriculture education activities in the classroom, and gardening on site. And regardless of providers' geographic locations, program type, socioeconomic status of families served, and especially regardless of whether their programs are located in food deserts or not, which in Alabama, there are a lot of food deserts. And it is also part of our mission to support the local economy by engaging our small farmers, including minority and women farmers. Next slide, please. So we really set our sights from the beginning on hearing from many different stakeholders, especially our providers and our farmers, and using these findings from the conversations as an essential element to guide our development of the strategic plan. So in just 9 months, we organized and led 4 focus groups, 2 with providers only, and 2 with a mixed group of providers, farmers, and some other partners, such as food hubs. We also created and disseminated an online and a paper version of a child care farm to ECE needs assessment to get a better understanding of what providers are currently doing in farm to ECE activities, their needs, their interest levels in these types of activities, beliefs about farm to ECE, and even what types of relevant materials that they already own. And Child Care Aware staff assess the findings, and they use the results to lead our Farm to ECE coalition through a strategic planning process, which Jessica and the team used a series of online surveys to help our coalition develop our main guiding principles, our strategic objectives, including our vision and mission and some core values that we share. Next slide, please. And so several key findings and overarching themes from the focus groups and needs assessments are highlighted here. And really overall, we learned that providers are really very interested in farm to ECE activities, but they generally need a lot of support, trainings, and resources to have a sense of where to begin and to really kick off those types of activities within their programs. Our farmers are also very enthusiastic to develop new partnerships with other types of institutions and markets. And through these discussions, we learned that there's definitely a need to help with building those relationships, and in many ways to support the work as a middleman, providing services such as a food hub to support group purchases, to make it feasible for farmers, and even possible for providers to purchase smaller case orders that would fit their needs, depending on the number of children they serve. And we also found that there are many challenges and several, in particular, very important needs for us to be able to help providers and farmers to work through to make this a reality in our state. And slide 4, please. There were several products that were developed for the purpose of this project, and the Alabama Farm to ECE Coalition and Child Care Aware worked together to develop the moderator's guides for the different types of focus groups, the needs assessment, the online and the paper versions, and then the strategic plan, which is a 3-year strategic plan and includes a child care overview for the state of child care in Alabama, a collective vision, mission, core values, and then 5 strategic objectives that we are using to guide our work moving forward. And so looking at our next steps for this work in our state, we are using the strategic plan and the findings from the focus groups and needs assessments to guide our work and our efforts to continue building our coalition, to engage new partners in this work, and then specifically to, 1, raise awareness of farm to ECE activities, and then provide educational opportunities by including workshops and conferences and integrating information into existing trainings that we already have going on, primarily working through our child care resource and referral agencies. And 2, we're also planning to develop some branding for the program just to give it a face and to develop some resources and fact sheets to answer questions that were asked during the focus groups. So I just want to thank you again, Jessica and the Child Care Aware of America team, for your support. This technical assistance program really lent our state a capacity to move forward and to organize our work more quickly than we could have ever done by ourselves. So thank you very much.
Thank you so much for sharing with us. That is really exciting to hear about. Next, we're going to hear from Elaine Russell, coordinator for Kentucky's Nutrition, Physical Activity, and Obesity Prevention Program in Kentucky's Cabinet for Health and Family Services. She leads the partnership for A Fit Kentucky, a statewide network of partners that focuses on improving access to healthy foods and physical activity to prevent chronic disease and promote healthy weight. Elaine holds a BS in dietetics from the University of Kentucky and an MS in community nutrition from the Eastern Kentucky University. She's going to share with us about how CCAoA supported ongoing obesity prevention efforts in Kentucky. Welcome, Elaine.
Thanks, and a special thanks to Child Care Aware for this opportunity. It really showed up in just the right time for Kentucky. So I'll give you all a little bit of background on where we came from and how Child Care Aware really supported our work to move forward. We started working in childhood obesity in 2005 with the Partnership for a Fit Kentucky, trying to understand what was already going on in the state and what people would like to see. We did 9 regional forums, and it was on our last forum we had a participant come up to us and tell us that we totally missed the early care and education setting. So we went from breastfeeding to child care, to schools, to healthcare, to work sites, just totally missing that. So in our next grant opportunity with CDC, we really focused on building a stakeholder group with state-level partners for early care and education. And so we studied, again, what was already happening in Kentucky and what we could do together. So we looked at current initiatives, we looked at current curriculums, we piloted programs like Knapsack, and we settled on a consistent message around 5210. So eating 5 fruits and vegetables, 2 hours of screen time or less, 1 hour of physical activity, and 0 sugary drinks per day. So that way, any type of curriculum could fit into it. CDC grants are always targeted on policies and systems. So I would push that to our stakeholders, and our stakeholders would push back and kind of set me straight. And they said, you can't really start off with policy. First, we need to look at training and technical assistance for early care and education providers to understand why we're making changes. And if we want to make that stick, we really have to work with family engagement. And then we can work on policy. So those 3 were our guiding infrastructure for our state plan. So since we had a plan and we had our stakeholders together, we were eligible for the Nemours Early Care and Education Learning Collaborative. And that's really that Cadillac model that gives you plenty of money to hire a coordinator and hire technical assistance providers. We knew as soon as that funding went away, then we would never have the opportunity to provide that same level of support. Our stakeholders did look into different opportunities between licensing and our QRS system so that we could try to improve our standards there. So we wrote recommendations and submitted them, but they felt like they met the bare minimum, and that was okay for now. We also looked at having recognition programs, but our stakeholders didn't really see that there would be value for early care and education providers who aren't regulated on these best practices. And for parents, it wasn't a value either because there was very few childcare to choose from anyway. So we went back to technical assistance with our pediatric mini-coin funding, and we looked, so how could we embed technical assistance into our organizations like CCAoA of Kentucky, or Child Care Health Consultants, and Cooperative Extension. So we found strengths in all of those organizations, but what they said was, we really need to have leadership for us to actually embed this into our work plans. So CCAoA of America came around for this opportunity. It was really that perfect timing. So we could look, how can we leverage our past success? But we need to convince our partners, like our government agencies and our child care providers, on how do we continue to invest in this work. So on the next slide. So Jessica and her team really helped us make a case for early care and education as that really critical space for promoting healthy habits. So we convened a couple of our partners, so the CCAoA of Kentucky and our Child Care Health Consultants, and Jessica and her team led us through developing a message specifically targeting agency leaderships and early care and education. So we wanted to find out what was the value to them and what's some of our evidence-based messages that we wanted to get out there. So they created a couple of tools, and you can go to the next slide. So you'll see this story map, and it's a great way to show our data of what we have here. So you can see that the purple colors are where we have our highest levels of obesity. Our orange colors are the ones where we have more food deserts, and the blue dots are where we have childcare providers. So that way we can really show on a visual aspect also where our poverty rates are, our obesity, food access, and where nutrition supports are, all on one map. So flipping through it, and it gives some people really something eye-opening to see. You can flip to the next slide. The other products were 2 one-pagers, one for early care and education providers, and then one for the agency leadership. In Kentucky, there's a really big focus on school readiness, but we wanted to make sure that the other evidence-based reasons also stood out to some of our decision makers. So not just that, well, do better in school, but also that when we have healthy eating and physical activity, we have better brain development. However, Kentucky has a high rate of food insecurity, especially for children at a young age. So if we can make sure that we have strong supports for nutrition and physical activity in the child care while they're there, it might help for what they're missing at home. We also knew that it supports the mental health and the social emotional health, and always, as always, it helps with healthy weight. On the back of these one-pagers were about health disparities, and it showed the map and our 3 guiding principles, and also led our child care providers to our online trainings. So we've already used these in a couple of spaces. One, we've used it in the Early Care and Education Insider newsletter. It goes to all child care providers. And we've also used it with our public health commissioner, who will put out a 2-minute message to all medical providers in Kentucky. So, but we also plan to take it back to our stakeholders and let them put together a comprehensive communication plan and figure out different ways of distributing this. But I do think just having Child Care Aware help us with this elevates the importance of nutrition and physical activity. It is a trusted name, and I think it really shows the leadership in our state that there's support for it nationally. So we really feel like this was a wonderful opportunity with us, and we appreciate the help. So thanks.
Thank you so much, Elaine. So just as a quick reminder, if anyone does have questions, either for Khaleesi in the information that she shared, or for Elaine, please do feel free to chat those in using our questions box or using our chat box. We're happy to address those. And Elaine, we did receive an enthusiastic comment of someone who was saying that the one-pager that was put together for Kentucky was really nicely done. So thank you for sharing that with us. That was great to hear about. Next, we're going to be hearing from Allison Setterland, who is the director of Georgia Head Start State Collaboration Office at Bright from the Start, Georgia Department of Early Care and Learning. She earned a bachelor's degree, or a Bachelor in Science degree in Child and Family Development at the University of Georgia, and a Master of Arts in Early Childhood Education from the University of Colorado in Denver. Prior to her current role, Allison provided early learning and literacy content expertise to Head Start grantees across the 8 southern states in Region 4 for the Office of Head Start. She has had over 20 years of experience in the areas of early care and education. So Allison, we're going to turn it over to you.
Thank you. It is so nice to be here today, and my job title is collaboration, and just being on this call today is such a true example of collaboration within our state, because I'm representing a team from the Department of Early Care and Learning and the American Academy of Pediatrics, our Georgia chapter. So I'm reporting out some of the good work we've done together for child care providers, for Head Start grantees in Georgia, and also our professional development system for trainers who work with all of those staff throughout the state. And just, a little bit about our agency to help understand the project that we undertook. Georgia is one of a few states in the country that have one birth to 5 state agency. So within our agency, we're about 700 strong here, and we cover childcare, licensing. Georgia's lottery-funded universal pre-K program is within this agency. CCDF and subsidy for childcare is in this agency. We have a research department, and we have all of the licensing and QRIS quality rated sits within DECAL. So when we have a partner like the American Academy of Pediatrics that wants to tap into the birth to 5 workforce or the birth to 5 population, it's a great one-stop shop for outsiders, we call them, for our external partners. And internally, we have a great way of collaborating internally as well. So every state has a collaboration director for Head Start. It's a federally funded position, and it sits somewhere under the governor. And so wherever they appoint that position to be, in some states it's in the Department of Ed, in some states it might be in the actual governor's office. In our state, the governor places my position here. So I kind of represent and make sure that those resources get to everyone in the child care community, because Head Start is federal to local dollars. Sometimes it's hard for them to plug in. So we have a great system here in DeKalb with working together. So this particular project really targeted the injured. We've had a big push regionally, nationally, and within our state to really have safer childcare and prevent injuries and have better active supervision and keep children safe while they're in our care, and also promote that safe care at home. So it was a perfect timing to partner with CCAoA for this TA opportunity, because what we needed the most was to sort through all this data. We have tons of data. Providers and Head Start grantees put a lot of information in, but what we realized is through this work that we didn't always have the right information to share out. So this resource that you're looking at is the Safety and Injury Prevention Grant that came through the AAP and through the national chapter of AAP to Georgia. And Georgia's AAP team, FOSIA SQ, partnered with us, which was DeKalb, Head Start, and the Georgia Head Start Association, to highlight these great free resources. So if you're looking at this, they're free to you. And we could have just said, hey, everybody, there's some good free training, have at it, because these resources are available online. But what we really wanted to do was, we know that our best advocates for good quality care are our professional trainers that are that get everything approved through DeKalb, and which is also within this agency, the professional development system. And so we knew that they're the best mouthpiece to get the information out. And we also were thrilled that these resources, because the AAP is our National Center on Health, we were just so excited to have real training that was developed by doctors, our medical professionals, is tailored to the early child care community, and of course free is always exciting. But so there's 6 modules that are you can sort of break down to a quick training or a longer 2-hour. And then there's a compilation of all of them. And so what we did was, I think you can go to the next slide. What we did was, and these are the topics, so different topics of childcare safety. But what we were able to do was bring in November, and then again next week, we'll have childcare providers alongside the Head Start health managers that manage the health and safety for grantees, and or trainers that are in our training system for a day and a half. And the first day they get to be with a pediatrician from the AAP. We're doing the training at a hospital, on the medical premises, with a doctor leading the training, and really going through how to use the materials, all the training notes. Each module is so great because it has objectives, it has quizzes, it has great adult learning strategies, so that you're not just sort of that talking head. So it's really exciting, because a lot of times, how it is in our community, we reuse old stuff. And so it's really exciting for Head Start and for childcare to have great, relevant, current resources. But what we figured along the way, and where this great intersection with Child Care Aware came in, is we wanted to be able to show those trainers what kinds of injuries are we talking about? Like, should we spend a lot of time on fires and burns or drowning issues if the main incidents and injuries are really falls and helmet issues with bikes? So they were our child care system that does all the licensing and reporting had been collecting lots of this data. You can, well, don't leave yet because I want to show them that map. So the map is the end, sort of the end result where when looking at, we were able to label the data correctly instead of just being by rule, because our problem was we had a lot of rule violations, but no one knew what the actual injury was. So they were able to go back, figure out how to map and identify what exact injuries were happening and where were they happening the most, so that when our child care trainers who are have been approved by DECAL, when they're out in the state, they can see where those highest rates of injuries are, and they can even reach out to some of those programs in that area and say, hey, we went to this training with the AAP and Georgia Head Start, and we saw that there was a lot of transportation related injuries here in Metro Atlanta. So we're going to offer this specific training and resource to you. So we were able to pair both the AAP work around getting that curriculum out into the hands of childcare providers and trainers with the technical assistance with the data with Child Care Aware, so that now when we're doing these Child Care Safety Summit, again, we did one in the fall, we'll have our last and second one. So every program in the state will have had this opportunity to sit through this training, but also pair that information with actual real live data on what we know is coming in from child care providers. So the next slide, I think, just summarizes some of those challenges that I mentioned. And this ultimately, I think the big win for us internally is that we have to report this data correctly. And before, it was a lot of back end work to try to take what was being put into the system and then track and count all those injuries and report it accurately to the feds. So this will help us tell our story better. It also helps our trainers pick what are some of the main issues happening, and it also empowers providers to know, hey, these are some of the top injuries reported in our area or in our state. And so it's been a real pleasure to take this journey, because I think anytime you can pair technical assistance around real-time data and information along with great material from the AAP, it was just a win-win for everyone. And I hope all of y'all will reach out to the AAP on their website and access those training materials, because wherever role you're in, there's something there for you, and it's really, really good material. Even if you don't have a pediatrician to deliver the training, it's designed to be very user-friendly. So that's my plug for the AAP and for DECAL. Thank you.
That's wonderful. Thanks so much, Allison. And you all heard that when she said free, right? Free resources.
Exactly.
So that's great. We so appreciate you sharing that, and how this data is helping you to tell your story, and just the impact that has had on your local efforts. So thank you for being here and for sharing that with us. If anyone does have questions specifically for Allison, please do feel free to chat those or add them to the question box, and we'll be happy to provide the best responses for you. So next we are going to hear from Jake McGow, who has been working to support and strengthen families through health and wellness efforts at the YMCA of San Diego County for over 14 years. He graduated from the University of Delaware with a degree in health behavior management and has used his education to help children, families, and childcare providers learn, grow, and thrive in a supportive environment. Jake is here to share more about how he worked with Childcare Aware of America to evaluate the Wellness Champion, which is just one project that the YMCA administers, and to assist families in improving their quality of life. So Jake, we're glad that you're here with us, and we're excited to hear more about this work.
Great, thank you. I'm just getting over a cold, so excuse my voice here. But good afternoon. I just want to start by thanking Childcare Aware of America for their expertise with with providing technical assistance to us on this project. Jessica and her team have really helped us tremendously with providing insight and guidance with the evaluation of this program and how we can look ahead. So here at the YMCA, support and oversee a lot of all of our community health projects. We receive a lot of different contracts from numerous funders, locally, statewide, federally, to help childcare providers increase quality around health and wellness efforts. And we work with family childcare centers, all providers, family, friend, neighbor. And the program I'm going to highlight here is the Wellness Champion program. Ultimately, if you're a wellness champion, you are recognized as a provider that has gone through a program, which I'll explain in a little bit, that is providing nutritious meals and snacks, providing opportunity for physical activity, and they have a unique kind of incentive that I'll discuss later. So our Wellness Champion program started, we received some funding from Kaiser Permanente in 2014 to begin the program. It actually was replicated after a training that a few colleagues and myself attended. The focus was on childcare providers becoming eco-friendly. So essentially, providers attended this kind of informative training and answered a checklist about products that were being used on their site, if these products were Environmental Protective Agency, EPA approved, things like that. And we thought that we could really replicate this idea by using the 5210 principles. So instead of using the eco-friendly products and going through a checklist that way, these providers would take an assessment, and the questions would relate to these 5210 principles, which I know we discussed earlier, but I'll review them again. So as you can see in this slide, 5 stands for 5 or more servings of fruits and vegetables a day, 2 hours or less recreational screen time, 1 hour or more of physical activity, and 0 sugary beverages, and also promoting to drink more water. And that's just a messaging campaign that we have been using here in San Diego. The steps to the Wellness Champion program: first, providers attend a wellness training workshop with a YMCA health educator. They complete a self-assessment and set goals for improving health and wellness in their program. So the goals are really derived and informed by the results from the assessment that they take in that initial training. Excuse me. They then work one-on-one with the health educator to achieve these goals. And finally, meet the best practices based on the 5210 principles. And this is seen with a post-assessment that shows the growth from the initial training that they attended. Due to the fact that the YMCA is the R&R in San Diego County, we are kind of positioned uniquely there. So the incentive there that we can offer, so when providers are designated a wellness champion, they receive preferred referral on our referral line. So we expect or hope that when parents are seeking childcare and they're asked if they would like a referral for someone that serves healthy snacks and offers opportunity for physical activity, they say yes, which yeah, we have been seeing. Thankfully, no one's saying no, but the preferred referral is especially valuable to those newly licensed providers who are really trying to drum up business. So that really, we found, has been helping them to increase their capacity. Since 2014, we've had about 170 providers complete the program, and there's an annual renewal that occurs at the end of each calendar year. So in December, we send out the checklist for them to check off and mail it back in for us. Next slide, please. We have not done a lot of evaluation on this project, believe it or not. So again, this is really helpful for Child Care Aware of America to assist on this part. While developing the survey, two questions were at the forefront. So question one is, are wellness champion providers following the 5210 principles more often than providers that are non-wellness champions? And the second question, are wellness champion parents following the 5210 principles more often than non-wellness champion parents? So essentially, we're asking surveys for parents and surveys for providers. So we sent out surveys to our providers via email or in person if our health educators were really in contact with them through that time frame. In San Diego County, we have about 4,500 or so licensed child care providers. So with much consideration, we felt we would have a better kind of response rate, I guess, if we really push those child care providers that were already engaged with us on other quality improvement programs. We felt like we already have kind of their buy-in, so it was easier for us to get a completed survey. And then because we don't necessarily work with parents or have a lot of that family engagement piece, collecting, excuse me, the parent portion was a small barrier. So as you can see, our parents surveys that we received, 19 on the bottom there, are a lot less than our providers that we received at almost 80. The parent, it's almost another degree removed from the work that we're traditionally working with our providers. As you can see also in that purple box, we have English and Spanish respondents. The providers, we received more surveys there than parents. And let's see. So most of the early childhood providers, early childhood education providers surveyed are following best practices for nutrition, screen time, physical activity, and beverages. However, wellness champions did outperform all non-wellness champions on most of best practices, which was great that we were seeing that. The parent respondents fell into two groups, obviously those whose children were enrolled in wellness champion programs and those who were unsure of their status. So none of the parents said definitively that their provider was not a wellness champion, so that's why we're calling them non-wellness champions. But overall, all parents need more support when it comes to serving fruits and vegetables, eliminating sugary drinks, and making sure their children have at least 1 hour of active play every day. Next slide, please. So while the sample size was small, the results suggest that the Wellness Champion program may be contributing to healthier practices in the ECE center, excuse me, in the ECE and at home. The provider survey showed that Wellness Champion programs may have the biggest impact on beverages ECE providers serve to children. In other areas, such as time allocated for physical activity and the frequency of serving fruits and vegetables, the Wellness Champion program may need to build in additional training and support to help them fully meet those 5210 principles. The results for parents were surprising. While wellness champions are not required to teach parents about the 5210 principles, parents still seem to be learning them. There could be different factors that play into that, so we're not quite sure, but it could be through the children, it could be through their regular interactions with providers, it could be anything that's, their interactions at work. But adapting the Wellness Champion program to include additional support for family engagement around healthy eating and active living could really boost the program's impact and ensure that kids are following healthy habits. Next slide, please. So Child Care Aware of America really have helped us to develop a couple one-pagers on Wellness Champion highlights and Wellness Champion survey results. These will be really helpful with moving forward to tell our story, along with having some qualitative data to show that the Wellness Champion intervention is effective and really working to improve kids' experiences regarding health and wellness. I also feel that the results will be helpful to examine and point out areas that the Wellness Champion program could be tweaked or changed to better suit the providers and assist with the impact of the program that the program is really trying to deliver. We'd also like to consider targeting our licensed exempt providers or family, friend, and neighbor. Currently, the program is just servicing providers that are licensed. Generally speaking, licensed exempt providers do not receive professional development and or training, but they're still taking care of our kids. So it's a missed opportunity that could be looked at. Presently, we have one contract supporting the program and are awaiting response for a proposal submitted a couple months ago. And we actually just found out last night that we received this contract. So another 2 years. We plan to share the information that was detailed in the one-pagers with our community partners to share highlights and just really reinforce the importance of instilling these healthy habits in kids at an early age. So yeah, we really appreciate the help that you've provided us for the past year. So thank you.
Thank you so much, Jake. We appreciate you sharing more about Wellness Champion and the 5210 principles. And congratulations on that contract. That's really exciting. Before we dive into the questions that we've received, we do want to take a moment to briefly share with you about the projects that we did in Illinois and New York. So I'm going to turn it back over to Jessica.
Thanks, Sarah. I just wanted to give a really brief shout out to the 2 other state projects that we worked on since we weren't able to get all of our partners on the webinar today. In Illinois, we worked with the Illinois Network of Child Care Resource and Referral Agencies and a great group of partners that they pulled together to develop a story map looking at access to high quality inclusive care for kids with disabilities. The full story map is phenomenal, and I encourage you to take a look at it on our website. We'll make sure to include the link to it in the email that goes out after this. But just as a snapshot, the image here shows the number of kids with individualized education plans. So the darker pink means more kids in that county having documented disabilities. And then the green diamonds show site-administered programs, which in Illinois are the only childcare programs that are eligible for enhanced subsidy rates for serving kids with disabilities. So it's a really complex situation that's hard to flatten on a map, which is why I encourage you to see the whole story map. But you can clearly see there are some pretty big gaps, especially in the middle of the state where there is, a definite need for high quality inclusive care. And at this point, there are no site administered programs, so no programs in that area that are receiving enhanced rate for serving kids with disabilities. Next slide. And then our final project was with the Early Care and Learning Council in New York. And we worked with them to conduct a statewide survey of expulsion and suspension practices among EC providers. So I've listed some of the key findings here, but we found 22% of providers had suspended a child within the last year and 19% had expelled the child. And then in line with national trends, we found that Black children, boys, and preschoolers were disproportionately affected by expulsion and suspension. So we saw some really interesting results in New York State, and ECLC and the state are already working to build upon these findings for their work in implementing the pyramid model and other social and emotional interventions to decrease expulsion and suspension in the future.
Thank you so much for sharing about those 2 additional projects. We'd like to provide you with the opportunity to share questions that you may have. These may be questions to Jess about the project and the support from Child Care Aware of America, or they could also be questions to any of our presenters on the work that they're doing in their states and cities as well. So please do feel free to type in those questions. And while we're checking to see if there are any questions, this is a great opportunity for us to express our appreciation for each one of these amazing partners who took the time to share with us today. We're so grateful for the opportunity to hear more about the work that you're doing and inspired by that work. And so thank you all for being here with us and for sharing with us as well. At At this time, I do not see any questions that we haven't already addressed with our content, but we do hope that as you are watching the recording of this webinar, if questions do come up, that you'll please reach out to us at Child Care Aware of America. We'd love to have the opportunity to share more information with you. Perhaps we can connect you with some of these amazing partners for more information, and we'd like to provide you with our contact information. So you'll see that at the end of the presentation, and encourage you to read about Healthy Childcare, Healthy Communities through their blog, and there's a link included there. And just encourage you to reach out to us if there is anything that we can do to support you and the work that you're doing each day as well. Great, so at this time, we're going to wrap up our time together. And again, great appreciation for the information and learning more about this project. And we look forward to connecting with you on another webinar very soon. Have a wonderful afternoon.